Hello, everybody. This is Dr. Serena Satcher, and you haven't seen me in a minute. I've been pretty busy, but I wanted to come and talk to you for a minute about diabetes again. And we are going to talk about today. A lot of people have been asking about what foods are working against our health and what foods are contributing to causing diabetes. The thing about diabetes and insulin resistance and prediabetes is that there's not just one single cause typically. Um, it can seem like it's one cause because it can seem like it's come on suddenly. But if you had your blood sugars for the past like 10 years. And if we put it on a graph, we would see a gradual increase typically. Now, what's happening now, which is a little bit different, is that in addition to viruses like Epstein-Barr virus, CMV, herpes virus, now we have COVID, and COVID can come in and what we call reactivate some of those old viruses or old infections. And that can be really challenging to your system, your immune system, to try to control. And sometimes that inflammation can become overwhelming, and then it can really seem like overnight, like you could be, like a week or two past having COVID and start having problems with insulin resistance that you had not seen before. But I find that there's usually some sign when I looked in the labs of people that had COVID recently and maybe they have long COVID, and I can see further back that there were signs of fatty liver or some changes in their systemic inflammation that was a precursor to them developing diabetes. So let's talk about first what foods are the most detrimental, okay? And I think the obvious thing is sugar, but it seems obvious, but may not be so obvious because people often are eating things that have natural sugars, but they learned somewhere along the way that the processed sugar is worse and that the processed sugar, gram per gram, may be causing insulin resistance. And that could be true for some because that sugar could be more inflammatory than a natural sugar. But what I find is that people are eating way too much natural sugar and they think it's like invisible sugar to the body, and it's not. So, for instance, I had someone that was eating honey, and honey can be risky anyways because honey um, could have syrup, like corn syrup, mixed in with it. You know how recently they've been talking about olive oil being contaminated and that they're putting things in it to stretch it to make it look like olive oil, but it's not really olive oil. Well, the same thing happened with honey. People were taking uh, corn syrup and mixing it into the honey, and you wouldn't be able to tell, except, some people are sensitive to corn. So I could tell when I've had some, actually, that Borden, it comes in packages and you get it in stores or in restaurants. It comes in a little rectangular package. And, there are some places where you could put it in your drink or put it on like a piece of bread or something, and it's made by Borden, and there's something going on with it. I don't know what the problem is, but I'm sensitive to that particular one. So I'm not accusing them of mixing in fake syrup. But another thing that can be done is that they could be feeding sugar to the bees. So that's not helpful either. But another thing that I notice is that people will eat a lot of fruit. I've seen people eating like a half a watermelon a day, and they think that's okay. But sugar is sugar, whether it's fructose, whether it's glucose, whether it's some other form of sugar, it is still going to register to your system as sugar. It may be less grams of sugar compared to regular sugar, but it is still sugar. Another example that I see people doing is coconut sugar, is fructose sugar, like in fruit. And maple sugar is another one. So, if you're eating too much sugar and if you're insulin resistant, it is still going to be a problem. So on this slide, I wanted you to see that the receptors for insulin on a normal cell, when the receptors are working, the nutrients and oxygen can get into the cell, okay? But then when you have insulin resistance, some receptors will accept insulin and others won't, but in general, there's a significant decrease in the number of receptors that can accept insulin. And if insulin can't get inside of the cell, it can't help the inside of your cell break down the sugars and the carbohydrates that you're consuming in your diet. So then what happens is there's other cellular dysfunction that starts happening. So, and the oxygen and the nutrients can't get inside the cell as easily. And further down the line, you develop disease where there's even more dysfunction. And what happens is glycation starts happening, which means that you're starting to hook sugar onto the cell, the protein membrane of the cell, or the thing that kind of keeps the membrane of the cell intact, starts to not work because it's getting stiff because sugar is binding to it. And when that when that happens, you start getting narrowing of the blood vessels on the inside of the blood vessels, capillary narrowing. And we can see this when we look at the carotids. There are tests that we can get on the heart to look at the blood vessels supplying the heart. They'll get calcified as they get more stiff. And you're creating more cholesterol in the liver because you have fatty liver. So there's a whole set of things that set up that start to dysfunction and not work well within the cells and within all the systems of the body. Diabetes and insulin resistance, it affects all the cells of the body. And this process can be reversed, it can be improved, but we have to make changes in our lifestyle to improve this situation. So that's where I come in, because in my practice, I can help you do this in a manner where it's sustainable, it becomes your lifestyle, it's also faster. As long as you have set your mind to make change and you want to know how, we can help you. However, if you have not made a decision to make a change, this might not be the right time for you. What'll happen in that case is you'll make changes for about 6 weeks, and then you'll go back and you won't be successful because you'll go back and start doing the same things you did before because you really haven't changed your mind yet. There are things that you can do to change your mind. We can help you to get a hold of resources that there are people, places, things. There are things that can be done to help you with that process. And we can help you with that with a consultation. So you can go to my website, which is Treat Yourself to Health, and put in treatyourselftohealth.com/schedule, and that'll take you directly to the schedule page. You can get a free phone consult for a few minutes. I can talk to you for a few minutes find out what the problem is, and then we can tell you how we can help that way. I can meet with you for a half hour for a small fee for what you would pay to go take your family out to dinner on a weekend, and less than a cable bill. And we can, in a 30-minute visit, you can upload some of your lab work that you've had done in the past quarter or the past half year, and I can help with interpretation. Of course, in functional and integrative medicine, in lifestyle medicine, we are taking a different approach at looking at your labs in a preventive way so that we're predicting disease or detecting signs of the disease before the disease diagnosis is made. And we can tell you how to reverse that process, just like we see here on the slide, get you back to healthy cellular health. So I hope this helps you today. And stay tuned. I'm going to talk some more about diabetes this month. So I hope that we get some interest in this. And like I said, contact me at my website and you can schedule a visit. This is Dr. Serena Satcher, Treat Yourself to Health, and we would love to help you. Take care. Bye-bye.